The advancements have been pretty great over the lifetime of hip replacement. They originally started back in the 50s and 60s and have progressed pretty drastically. In the 80s and early 90s is when this really became a very common procedure, and the implants were very good, but the bearing surface, so the plastic surface, that's really the main kind of functional cartilage, if you will, in the hip replacement, did not have as good of longevity. There's been some big advancements since that time. So the plastics had a big change in the structure of them. As we've seen over the course of the first 15 to 20 years of those being used, there's really no signs of wear and tear. So we expect with the new implant designs that we should at least see 30 years, if not more, of lifespan, which has been a really huge advancement because it allows us to potentially treat patients at a younger age without as much worry about repeat surgery or wearing out the components.
Surgical technique standpoint, there's multiple different ways to get at the hip, and many people prefer one technique versus another. There was a hip method that was used very early on, was brought back, going at it the hip from the front, where you go between two muscles. It was a little bit more technically demanding at first. It's a little bit of a difficult skill to learn, but that's become more of a popular approach to the hip, potentially leading to a little bit quicker recovery.
Another big advancement is two pieces of the surgery process, the anesthetic and pain control, and then also the recovery process. So yes, we've drastically sped up the recovery process, and that's for a couple reasons. One, we've learned very much so over the course of history that placing patients in bed doesn't do much for them. In the distant past, or in the original kind of process, patients laid in bed for several days. They were in the hospital for a couple weeks. And now we're at a point where we're doing hip replacements in an outpatient setting where patients are up walking 2 hours after the procedure. They're putting full weight on the hip, and we really allow them to progress that activity as quickly as they can. And it's been pretty dramatic to see that. A second reason why that's so possible is how we're now managing the pain of the surgery. The vast majority of patients have a spinal anesthetic now for hip replacement instead of general anesthetic. And what that does is it controls the pain very well, but it also allows us to use less sedative medicine and less anesthetics during the actual procedure. So they're much less groggy, much less tired and fatigued after the surgery, which allows us to be able to get them up and moving as quickly as we do.